Good morning everyone, Shraddha Vasnik here. In today's lecture, we are going to study about the peripheral nervous system. Peripheral nervous system, it is the system which connects our central nervous system to the rest of our body. In peripheral nervous system, it consists of two main nervous system. First is central nervous system and second one is peripheral nervous system. In peripheral nervous system, there is a main system which is known as the autonomic nervous system and second one is somatic nervous system. Autonomic nervous system consists of sympathetic nervous system and parasympathetic nervous system. Then first is autonomic nervous system. Autonomic nervous system, it is the independent nervous system. It is independent of voluntary control. It is self-regulating system, which means auto means self and nomos means regulating. Autonomic nervous system consists of two systems. First is sympathetic nervous system and second one is parasympathetic nervous system. Sympathetic nervous system prepare the individual to adjust to stress and prepare our body for flight or fight mode. This is the sympathetic nervous system. And parasympathetic nervous system mainly plays a role in tissue building reactions. The anatomy of autonomic nervous system include both branches of sympathetic nervous system and the parasympathetic nervous system. It consists of myelinated preganglionic fibers. Then what do you mean by myelinated fibers? Myelinated fibers, it means the cluster of nerve cells which is known as neurons are surrounded by the protective fatty covering called as myelin, and the fiber is known as myelinated ganglionic fiber. So it includes the both branches, that is sympathetic nervous system and parasympathetic nervous system. It consists of myelinated preganglionic fiber and postganglionic fiber, which are non-myelinated. The myelinated preganglionic fiber forms the synapse with non-myelinated postganglionic fiber. Synapse means the small gap between the terminal end of the one neuron, which is pre, and the beginning of the another neuron, which means post. The postganglionic fiber forms synapse with receptor of the organ, and the synapse between the pre and the postganglionic fiber is known as ganglion, and the synapse between the postganglionic fiber and the receptor, it is known as neuron effector junction. The main neurotransmitter of the sympathetic nervous system is adrenaline. Hence, this system is also known as adrenergic system. And the main neurotransmitter of parasympathetic nervous system is acetylcholine. Hence, the system is known as cholinergic system. The neuronal communication through the chemical messenger, that is neurotransmitter or hormones, is known as neurohumoral transmission. Now, cholinergic drugs. Cholinergic drugs are also known as parasympathomimetics, cholinomimetics, or cholinergic agonist. Cholinergic drug means the drugs which are the pharmacological agents which, when administered, they mimic the response elicited by parasympathetic nerve fiber. The receptors are muscarinic receptors, which are present in heart, eye, bronchi, smooth blood vessels, etc. Then nicotinic receptors which are present in adrenal medulla, skeletal blood vessels. Then classification of cholinergic drugs. The main classes of cholinergic drugs are esters of choline, for example acetylcholine, then cholinomimetic alkaloids, example pilocarpine, then anticholinesterase. It consists of three class. First is reversible synthetic, example neostigmine. Second one is reversible natural, example physostigmine. And third one is irreversible, example organophosphorus compounds. Then mechanism of action of acetylcholine. Firstly, we are going to study about the muscarinic action of acetylcholine. The mechanism of action of acetylcholine on heart. On heart, when the acetylcholine combines with the muscarinic receptor of heart, it decreases CAR. C square AR, it stands for conductivity, contractility, automaticity and the rhythmicity of heart. It depresses the SA node and reduces the conductivity, contractility, automaticity and the rhythmicity of heart. It also decreases the heart rate, produces bradycardia, and it also decreases the blood pressure known as hypotension. On bronchi, when acetylcholine combines with the muscarinic receptor of bronchi, it produces constriction of bronchi which causes bronchoconstriction, and due to this there is difficulty in the respiration, so it is contraindicated in bronchial asthma. Then on secretion, acetylcholine increases salivary, gastric and intestinal secretion. Then on smooth blood vessels, it dilates the smooth blood vessel, which means it produces relaxation. It decreases the blood pressure, hence produces the hypotension. The main action of acetylcholine is on eye. When the acetylcholine is combines with the muscarinic receptor of eye, it produces the constriction of pupil of eye, which means relaxation of suspensory ligament. It also decreases the tension on the lenses. When there is the reduction in the size of the pupil of eye, known as miosis. Due to miosis, focal length also decreases, and due to this, person can see the object which are near to him but unable to see the object which are far away, and the vision is fixed for the short distance, known as spasm of accommodation. As the acetylcholine reduces the intraocular fluid, it is used in the treatment of glaucoma also. Then on gastrointestinal tract, it increases the tone, motility and peristalsis. Then nicotinic action of acetylcholine on skeletal blood vessel, it produces contraction of skeletal vessels which increases blood pressure, which produces the hypertension. And adrenal medulla, it stimulates the adrenal medulla to release adrenaline and noradrenaline. These are the mechanism of action of acetylcholine on muscarinic and nicotinic receptor. The contraindications of acetylcholine. First is bronchial asthma. As the acetylcholine, when combines with the muscarinic receptor of bronchi, it produces the constriction of bronchi, which result in bronchoconstriction and which produce the difficulty in respiration. Hence, it is contraindicated in bronchial asthma. Second one is peptic ulcer. As acetylcholine increases the gastric acid secretion, it may worsen the peptic ulcer or the particular condition. Then hypotension and bradycardia. Acetylcholine decreases the CAR, which means conductivity, contractility, automaticity and rhythmicity of heart. It produces hypotension and bradycardia, which means it reduces the heart rate, produces bradycardia and reduce in the blood pressure known as hypotension. These are the cholinergic drugs, mechanism of action, classification and contraindication of acetylcholine. Thank you so much for being there.